advance directive is a legal document that lists your wishes should you be unable to speak for yourself in the healthcare world. It provides information about what your wishes are, specifically if you were unable to breathe or your heart were to stop. And it's important because if that were to happen to you, we really don't know what your wishes are, and so it's important to write those down for your family and for the medical staff. The time to complete an advance directive is really now. And that's for anybody, whether you're sick or you're healthy. Again, it's sort of you're preparing in case. So to get an advance directive, you can ask your doctor. For our patients, it's usually their oncology office here. You can get it from your primary care provider. You can certainly reach out to your social worker or anybody in our support services if you're here at Sibley. You can also go online. There's resources, there's websites where you can look up what your state's advance directive is. We typically use a document called the 5 Wishes document, which is put out through an organization called Aging with Dignity. The first wish is the person I want to make care decisions for me when I can't. So that's when you designate what's called a healthcare agent. When you are unable to make the healthcare decisions for yourself, that's that designated person. So for a lot of people, it's their spouse. For people with adult children, it may become their oldest child. The kind of medical treatment I want or don't want would be the second wish, and that is where you can get more specific. So if you're in a situation where you would need something like artificial nutrition, or whether or not you want to be kept alive on something like a ventilator, that's where you would designate those. The third wish is how comfortable I want to be. You want to make sure that you're addressing things like pain, any other symptoms that you're having, how much medical intervention do you want. The fourth wish is how I want people to treat me, and that can include anything from how you want to receive information, how you want maybe a family member to receive information. The fifth wish is what I want my loved ones to know. It's really an opportunity to give as much or as little information that you want to your family members. Some people you can add additional sheets of paper to add letters to loved ones. You can get as specific as you want. Filling out this form can be really difficult for patients and their families. Just addressing these questions can be a little overwhelming, especially on top of a cancer diagnosis. It's really something that's at the forefront of their mind, and maybe they don't want to talk about these things right now. So really what we want is for you to take the document, take it home, talk to your loved ones, go over it, take your time, and really complete it as much as you want. The biggest thing that we want people to fill out is really that healthcare agent, the first wish. Just so you have someone designated that knows what you want to have happen, you can have their information down and you sign it. And that way we know what you want, your family knows what you want, and those are the people you want to be discussing it with. The other good thing about this document is that it can change. You can complete a totally new document, you can go through and make changes, you can change the healthcare agent. So it's, you can update it as often as you want. Your 5 Wishes document or your advance directive is really something you want your healthcare team to have. For us, our medical oncology department should have a copy, and we can put it in your chart, so we always are able to reference it. At home, you want to make sure that the person that you've designated as the healthcare agent has a copy, or at least knows where to access it. We want to make sure that we're representing your goals and your wishes as best we can.